In this video, we are going to learn about inpatient coding of charts from obstetrics section. So to begin with, the procedures performed on the products of conception, they are coded to obstetrics section. But the procedures performed on pregnant females, that is on the mothers, it is coded to the root operation in medical and surgical section. For example, the amniocentesis is coded to products of conception, but the repair of any lacerations, it is coded to medical and surgical section. And sometimes there will be procedures following delivery or abortion. For example, curettage of endometrium, it is coded to root operation extraction in obstetric section, but the therapeutic dilation or curettage performed during times other than this delivery or abortion is coded to medical and surgical section to the root operation extraction. So the patient was admitted with pregnancy at 38 weeks gestation, a low C-section and elective open bilateral tubal ligation were performed. So there are two procedures happening here. One is low transverse C-section and bilateral tubal ligation. So the C-section is coded to root operation extraction, and this bilateral tubal ligation is coded to the root operation occlusion. So first is low transverse C-section. So first we should search for root operation in the index. So here there are two methods or two ways. First is we can directly use the term delivery. So under delivery, cesarean. So here it is mentioned C extraction products of conception. So under extraction, you search for products of conception. So on the products of conception, we have ectopic, extraperitoneal, high, low, mid, retain, vacuum, etc. So here our area of interest is low C-section. So products of conception and low. So the table is 10D. So next moving on to the table 10D, and the body part is products of conception and the approach is open approach and no device, and the qualifier is low. And next procedure in the patient chart was occlusion of bilateral fallopian tubes. That means the tubal ligation of bilateral fallopian tubes is coded to the root operation occlusion. So we should search for the term occlusion from the index, and under occlusion we should search for fallopian tube. So fallopian tube, and under fallopian tube bilateral. So we get the table 0UL. So the table 0UL, and you search for the body part, that is bilateral fallopian tubes. So 7 and open approach and no device and no qualifier. Next example, woman with trichorionic triamniotic triplet gestation at 28 weeks was thought to have premature rupture of membranes, and she was placed on magnesium sulfate after rupture of membranes was ruled out. So tocolysis and internal monitoring of fetal heart rate via an intravaginal electrode were continued until she underwent spontaneous rupture of membranes 1 week later. So she had a rapid vaginal delivery with live-born triplets, and the fetal monitoring electrode was removed. So here there was monitoring of fetal heart rate via insertion of a electrode, and also delivery with live born triplets. So you should code for both monitoring of fetal heart as well as delivery. So first we should code for delivery. So we should use the term delivery and use search in the index, and in the index under delivery search for manually assisted. So 10E. So we should go to the table 10E, and under 10E the products of conception, external approach, no device and no qualifier. Next, insertion of monitoring electrode. So what was happened here? The internal monitoring of fetal heart rate via intravaginal electrode were continued. So we should code for this procedure as well. So for that we should use the term insertion. So the root operation is insertion. The insertion we should search for products of conception. So 10H. So we should go to the table 10H followed by products of conception, open approach, via natural or artificial opening. So here the procedure is done via natural or artificial opening, and monitoring electrode is coded with the device, and the qualifier is no qualifier. So the root operation is insertion, the body part is products of conception, and the approach will be natural or artificial opening, and the device is monitoring electrode and with no qualifier. So the important to remember here is we should search or we should use the term insertion from the index. Next, monitoring of products of conception. So in this previous code, we coded for insertion of this electrode, and monitoring of that electrode or monitoring by using of that electrode is coded by using the root operation monitoring. So under monitoring, we are monitoring here the products of conception. So under monitoring, we should search for products of conception. So under products of conception, the fetal heart rate was monitored. So the fetal heart rate comes under cardiac. So under cardiac, sound, you know, or rhythm rate electrical activity all comes under 4A1. So we should use the table 4A1. So here the rate was monitored. So the table 4A1, see here the root operation is monitoring. You can always check the root operation here. That means the third character always indicates the root operation. See, monitoring. So we search for the term products of conception. So H. So the approach is via natural or artificial opening 7. And we are calculating or we are monitoring the rate and with no qualifier Z. So monitoring products of conception, natural or artificial opening, device or function rate, and the qualifier is no qualifier. So next example, the patient admitted for management of an intrauterine fetal death at 23 weeks. So she elected to have medical induction of labor via intravenous infusion via the arm rather than waiting for a spontaneous delivery and was admitted. Kerosene drip was started and some contractions were obtained, but the cervix remained unchanged. So dilatation and curettage were performed and she was discharged thereafter. So the procedure here is abortion and followed by dilation and curettage. So abortion, intrauterine fetal death, followed by dilation and curettage. So first we should code for abortion. So we should use the term abortion. That means the root operation is abortion, and under abortion we should search for products of conception. So products of conception. So 10A. And here we can also use this term termination of pregnancy. So with this term also we can identify the table. So termination of pregnancy, and termination of pregnancy we have different entries. See, dilation and curettage. So 10A. Here also abortion, products of conception 10A. So we should check the table 10A. So products of conception, body part by a natural or artificial opening, and no device and no qualifier. See, the root operation is abortion. Next, so what is happening in this patient? See, epitocin dip was started, and we should code for this as well. So it is coded with the root operation administration. So for that we should search with the term introduction of a substance in or on from the index. So introduction of substance in or on, and under that we should search for vein because the hormone is inserted into the vein. So under the vein peripheral vein. So peripheral vein, and on the peripheral vein, we are inducing hormone. So 3E0. Understood? First, we should use the term introduction of substance in or on, and under that we should use, we should check for vein, and under vein, peripheral vein. Here, see peripheral vein, and under peripheral vein, we are inserting or we are inducing hormone. So 3E0. So we should use the term 3E0. So this is the part of the table of 3E0. Under 3E0, the peripheral vein, the body part, and the approach is percutaneous approach. So we should follow this row, the peripheral vein, percutaneous approach, and hormone is being induced here. Hormone, and the qualifier will be other hormone. So 3, V and J. So important to note here is you should use the term introduction of substance in or on from the index. Okay. So next example, patient in 38 week of gestation was admitted with contractions occurring every few minutes. The membranes were artificially ruptured. Then 6 hours later, she was tried on intravenous, again pitocin augmentation, and within the hour progressed to complete dilation and began pushing. She pushed for 2 hours and was unable to progress satisfactorily due to arrested active phase of labor. She was taken to surgery where a lipid low transverse C-section was performed for obstructed labor due to cephalopelvic disproportion. So we should code for C-section. So the root operation will be extraction, and under extraction we should search for products of conception, and under products of conception, low. So low 10D. So 10D, and the body part will be products of conception, the open approach, no device, and qualifier will be low. So here drainage is also coded because see the membranes are artificially ruptured here. So we should code this procedure as well. So it comes under the root operation drainage. So drainage of amniotic fluid. So we should use the term drainage from the index. Or we can also use this term artificial rupture of membranes. CAROM. So the quick hack here is, if we know that a separate entry called artificial rupture of membranes is there, then we can directly check with this term AROM, or artificial rupture of membranes. Understood? We should know that artificial rupture of membranes is separately included in the index. Then we can directly search for this term. Then you can directly get to the correct table. So it comes to the table 109. See, 109. See here the root operation here is drainage. You should always check the root operation here. See, drainage. So products of conception via natural or artificial opening, and no device, and amniotic fluid. Therapeutic. It does not comes under diagnostic. So amniotic fluid, therapeutic. So this word is important to remember. Artificial rupture of membranes. Next, patient was admitted in active labor at term 38 weeks gestation, and she had multiple sclerosis which had been exacerbated by pregnancy. So in the delivery room, she spontaneously delivered a live born female infant over a midline episiotomy without complication. So delivery as well as a procedure is being done on the mother, that is midline episiotomy. So first we should code for delivery. So we should use the term delivery, the root operation in the index, and under the delivery you should search for products of conception. So products of conception, so 10E. So we should go to the table 10E, and under 10E, products of conception, external approach, no device, no qualifier. And apart from delivery, you should also code for episiotomy, midline episiotomy. So according to the guideline, the procedure done on the mother are always coded to medical and surgical section. So that procedure of midline episiotomy is coded to the root operation division. So we should use the term division in the index, and under division, episiotomy is done at the female perineum region. So we should search for perineum, female. So 0W8. So 0W8. You can always check the root operation here, division, see division, episiotomy. So 0W8 and perineum, female, external approach, no device, no qualifier. So midline episiotomy is always called to the root operation division. Next example. Patient admitted for delivery as spontaneous and vaginal with midline episiotomy which extended into third degree laceration. So here what is happening is a midline episiotomy extended into third degree laceration, and this third degree laceration of the perineum and the anal sphincter were sutured. That means a repair procedure is being done here. Repair procedure. So delivery, episiotomy, and a repair procedure. So hence we should code for delivery, episiotomy, as well as repair. So hence we get three codes. First we should code for normal delivery, that is we should use the term delivery from the index, and in the index delivery products of conception 10E. So we should go to the table 10E, products of conception, external approach, no device, no qualifier. So next is we should code for episiotomy. So episiotomy comes under the root operation division. So division, and the division we should search the term perineum. So perineum, female. So 0W8. So we should check for the table 0W8 and perineum, external approach, no device, no qualifier. So what was mentioned in the chart? A third degree laceration and anal sphincter were sutured. So we should code for that sutured procedure, and it is coded to the root operation repair. So under repair you should search for anal sphincter. See 0DQ. Here we can also use the term sphincterography. If we know that sphincterography means the procedure related to anal sphincter. See, or you can always go through the easy way, repair anal sphincter. So 0DQ. So in either way we get the same table, 0DQ, sphincterography anal. So the 0DQ table, anal sphincter are open approach, no device, no qualifier. So next example, patient at 12 weeks gestation wished to have the pregnancy terminated following studies showing the fetus to be abnormal. An intrauterine saline injection produced an incomplete abortion. See, abortion here. So this procedure was followed by dilation and curettage. So abortion procedure followed by dilation and curettage. So first we should code for abortion. So abortion, first we should use the term abortion in the index. Actually that one image was missing here, and under abortion we should use this term abortifacient. So we'll get to the table 10A. So 10A, products of conception by a natural or artificial opening and no device, and C, abortifacient. See, abortifacient. You know? Next, the spontaneous abortion is always coded to the root operation extraction. So under root extraction, you should search for products of conception. And if it is retained, you should use the term retain, 10D. So 10D. And products of conception retained, see here. And by a natural or artificial opening and with no device and no qualifier. So spontaneous abortion is coded to root operation extraction. So another example, spontaneous abortion followed by dilation and curettage. So spontaneous Abortion is coded to root operation extraction. So under extraction, products of conception and retain here, and followed by dilation and curettage. So products of conception. So we should use the row here we use is this row. So products of conception retain, natural or artificial opening and with no device and no qualifier. So another example. So in this, the tubal pregnancy was removed endoscopically via a small incision in the abdomen. So the procedure is removal of tubal pregnancy endoscopically via a small incision. So here, removal of tubal pregnancy is coded to the root operation resection. This is important. Though the procedure is related to pregnancy, because it is just removal of tubal pregnancy, it is coded to medical and surgical section, and then with the root operation resection. So we should use the term resection. Under resection, we should search for the term products of conception. See, ectopic pregnancy. So ectopic here represents ectopic pregnancy. So 10T. So 10T, followed by 2 products of conception, ectopic percutaneous endoscopic approach. See, via a small incision in the abdomen. It represents percutaneous. So percutaneous endoscopic. No device and no qualifier. No device and no qualifier. So next example, type 1 diabetic patient on insulin was status post low transfer C-cell delivery 12 days earlier. The day before admission, she noticed a large amount of blood discharge from her cesarean wound. So she was taken to the operating room where the wound was open and a very large hematoma was evacuated from the abdominal subcutaneous tissue. So the wound was drained and packed, and 3 days later, a secondary wound closure was accomplished. So here, hematoma was evacuated and secondary wound closure. So this evacuation of hematoma is coded to the root operation extirpation. Understood? You should not get confused with the term extraction. Extraction is different from extirpation. So here we remove this hematoma. So extirpation of matter from abdominal subcutaneous tissue and fascia. So we should use the term extirpation, and under extirpation in the index we should search for subcutaneous tissue. So subcutaneous tissue, and under subcutaneous tissue here the repair, the evacuation of hematoma is done and the abdominal region. So abdomen 0JC. So we should go to the table 0JC. So 0JC, and we should use subcutaneous tissue of abdomen. So 8, and the approach is open approach and with no device and no qualifier. So here important guideline to note is, see, whenever there is some procedure like excision, extraction, repair or inspection on different or overlapping layers of musculoskeletal system, then we should go to the deepest layer. That means, for example, if there is excisional debridement that includes skin, subcutaneous tissue and muscle, you should always go to the deepest layer. That is, the deepest layer here is muscle. So you should always go to the muscle body part. So here the deepest here is subcutaneous tissue and fascia. Understood? If this extirpation was done up to the muscle region, then we should go to muscle, but here only subcutaneous tissue and fascia, abdomen. So this evacuation of hematoma was followed by secondary wound closure, and this is coded with the root operation repair. So repair, abdominal wall, external approach. So we should use the term repair, and we should search in the index, and under index abdominal wall Repair under repair abdominal wall. So 0 WQ. So 0 WQ. See here, repair root operation. And the repair was done in the abdominal wall. See, abdominal wall. External approach. And no device, no qualifier. See, in here also there is abdominal wall, but there is no external approach here. So hence we should use this row. Abdominal wall, external approach, no device, and no qualifier.